Are the commercials right? Can you really get $148 or $150 a month back into your Social Security check? Well, the answer is probably not. My name is Christian Brindle. I'm a Medicare health plan expert and specialist, and today I wanted to educate all of you on what those TV commercials are really talking about. So you've probably seen a lot of different TV commercials throughout the open enrollment period the last couple of years, and this year is no exception, right? You're seeing them rank up and actually really pop on your TV screen more than ever the last couple of years, but particularly this time of the year in the fall during the Medicare open enrollment season. So what these actually are is they are call centers, large call centers that are backed by Wall Street, typically by private equity groups, that dump a lot of money to advertise nationwide to try to get you to call into their call center so they can sell you a Medicare Advantage plan. That is what their agenda is. What these commercials are actually doing, next time you see one, if you have TiVo or if you have the ability to do this, pause and actually close up on the fine print on the screen and take a look and see what it actually says. One thing it's usually going to say is one of two things that I've noticed every single one that I've ever seen. And I know this because I also offer the exact same plans that they do. And so I know that what they're talking about on the TV commercial is incredibly misleading. It's actually very predatory marketing in my personal opinion. And I think it's very unfortunate that Medicare does not step in and kind of do something about this, because so many people are victimized every year by being thrown onto a plan that doesn't do this, doesn't have prescription coverage, doesn't cover their doctors, and they're just left out in the cold for a long period of time. But essentially what you're seeing is in those fine prints on those TV commercials, it will say either one of two things. Number one, first of all, it's going to say it depends on your area, right? The plan availability will be determined by your area. There are very, very few plans in the United States of America and very, very few markets, right? Sometimes it might be 2 or 3 counties in Florida, for example, and they market that commercial all 50 states just to get you to call in. But they'll say something along the lines of you will not be able to get this plan unless you live in a certain area, or you won't be able to get this plan that we're talking about unless you qualify for your state's Medicaid program. So what is Medicaid? Medicaid is assistance for people by your state government for people that are either disabled or incredibly poverty levels of income, low levels of income. Because essentially what they're talking about is your Medicare Part B premium. Your Medicare Part B premium is $148.50 a month in 2021. It's subject to change in 2022. So sometimes they're talking about that your state Medicaid program could pay that for you if you qualify for the state Medicaid program, but that company has nothing to do with it. It's very misleading, it's very predatory, and it actually doesn't come from any insurance company. Some insurance companies will put $20, $30, $40, $50, $60 a month back into your Social Security check, but not in every market. It's going to really depend, it's really going to vary. So before you call the call centers, make sure that you watch this video and understand what you're actually looking at. Before you call Joe Namath, understand this. These call centers are getting calls from people in all 50 states and all different markets, and they just don't really know your market very well. They're probably going to put you on a plan that's not the best for you in most cases, and I see this happen all the time. So in my personal opinion, folks, see through the ads for what they really are, and I hope you take my message into consideration this open enrollment period. Anyway, folks, if you found this video helpful, drop a like on it so it helps more people just like you. I want to save more people this open enrollment period. Have you seen through some of the garbage that I have with these TV commercials? If you have, drop a comment down in the comment section. Let us know about it. Hit the subscribe button so that way you don't miss a single video we put up about Medicare and insurance education. And until next time, thanks so much for watching. Happy Medicaring.